or good afternoon, good evening, wherever you're tuning in from. Thank you for joining us today for this panel discussion on planetary health, practice, policy, and research. So before we begin, you can move on to the next slide. We wish to acknowledge the land on which the Infectious Disease Working Group operates. For thousands of years, it's been the traditional land of the Algonquin and Anishinaabe Nation, the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. This land is in the Dish with One Spoon territory, which is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. And today, this meeting place, Toronto, is still home to many Indigenous people across Turtle Island. And as students from migrant and settler backgrounds, we are grateful to have the opportunity to live and work on this land. We do recognize the social and structural systems that have historically and continue to disproportionately impact Indigenous communities, including infectious diseases. So to start off, I'll give a brief introduction to the IDWG, or the Infectious Disease Working Group, and who we are. So my name is Nidhi, and I am one of the two co-leads of IDWG, along with Lauren. You can see our pictures at the bottom. So IDWG was formed in January of 2020 by a group of students at the Dalalana School of Public Health here in Toronto, in response to the growing knowledge gaps around COVID-19 during the time. So there was and still is a pandemic, but at the same time, there was also an infodemic. And since then, we've been focusing on dispelling pervasive and harmful myths about infectious diseases and promoting health equity, community engagement, and advocacy. And we've grown to cover public health and global health issues more broadly as well. Our team consists of the co-leads, the communications team, the knowledge translation team, events team, and the community engagement team. And you can find us all on the social media platforms that were listed on the previous slide, including LinkedIn, Instagram, Twitter, and our website as well, which is just idwg.ca. Today's panel discussion, as you all know, is on planetary health, and this panel was organized by our lovely events team, led by Sarabi, Ronaz, and Megan. And I'll now pass it over to them. Enjoy, everyone.
Thank you, Nidhi. My name is Ronaz Ramtula, and I'm one of the co-directors of events for the Infectious Disease Working Group, along with Sarabi and Megan. Sarabi and I are in our second year of our Masters of Public Health in Epidemiology, and Megan is in her first year. Sarabi, Megan, and I will be your moderators for today's event. So there are a few housekeeping items we would like to go over. First, this session will be recorded. This is a Zoom webinar, meaning that all participants are muted on the call. Our panelists will each have the opportunity to present, and at the end of our 4 presentations, we'll have a question and answer period. We ask that you send your questions through the Q&A function at the bottom of your screen throughout the webinar. Please respect the speakers and other participants in the webinar and do not screenshot or record without permission. Finally, if you need technical support during the webinar, you can message me privately on Zoom, or you can email me at ronaz.remtula@mail.utoronto.ca. This information will be available in the chat. We have a wide range of panelists who we're very glad could join us this morning and are experts in the field of planetary health. First, I would like to introduce Dr. Paula Braitstein. Dr. Braitstein is an epidemiologist and environmentalist living and working in the Western Highlands of Kenya. Witness to the massive social, economic, and environmental challenges and changes taking place in East Africa, Paula has begun leveraging her success in population health to direct her research and attention to what is likely to become the single biggest threat to health and well-being of future human generations: planetary health. Paula is the holder of the prestigious Research Chair of Applied Public Health from the Canadian Institutes of Health Research and is an associate professor at the Dalalana School of Public Health. Next, we have Dr. Edward Shia. Dr. Shia works as an emergency physician at University Health Network and is a clinical assistant professor in the Department of Family and Community Medicine at U of T, where he recently served as the faculty co-lead of climate change and health. He has volunteered with the Médecins Sans Frontières, Toronto Addis Ababa academic collaboration, and community clinics for underserved populations. Dr. Shia is currently a board member of Toronto Environmental Alliance and a fellow at the Center for Sustainable Health Systems. He recently became a PhD student with research interests in health policy, economic evaluation, and structural determinants of health. Our next speaker will be Carlos Sanchez Pimienta. Carlos is interested in unsettling mainstream understandings of planetary health education by respectfully engaging with the knowledge and practices of Latin American and Indigenous communities. He has published on culturally relevant gender-based analysis, public health responses to the climate crisis, and Indigenous health promotion. Carlos is currently a PhD student in the Social and Behavioral Health Sciences program at the Dalhousie School of Public Health. Finally, we have Dr. Byomkesh Talukder. Dr. Talukder holds a PhD in Geography and Environmental Sciences, an MES in Environmental Sciences, an MSc in Developmental Science, and an MSc in Geography and Environment. He is the inaugural Planetary Health Fellow at the Dalhousie Institute for Global Health Research, where he works at the intersection of health, sustainable development, climate change, and food and agricultural systems. He's currently working on several research projects at a national and international level surrounding climate change in relation to food supply chains, ecological footprints, and more. Since 2016, he has been a MITAX postdoctoral fellow at Parmalat, Canada, and the Desautels Faculty of Management at McGill University. I think we can get started with our presentations now. Dr. Paula Braitstein, you are now welcome to share your screen and get us started.
Hello, everybody. Let me just share my screen here. Okay, can you see it?
Yes. Yes, we can.
Excellent. Okay, I'm going to turn my video off once I get started, just because I'm in Kenya and bandwidth is an issue. Okay, so hi, everybody. Thank you so much for inviting me to participate on this panel. I do get very excited when talking about some of these issues, particularly to public health students, and especially actually to U of T public health students. I find that you guys are very, very open and excited and ready to get going. So, ready to get going on addressing some of these issues. So I'm really happy to see that you've got a lot of participants on, and I'm delighted to just kind of dive in. I'm an epidemiologist. I'm with U of T, and although this isn't really my area of focus, I've taught it for a number of years for reasons that kind of came up in my introduction. All right, so without further ado. So basically, we're at a point where people are healthier, societies are healthier than ever before, with improvements in life expectancy, decreases in poverty, of course, pre-COVID, and also decreases in child mortality. We're really faced with a bit of a conundrum because it's come at a high cost to the environment. Of course, our CO2 emissions have skyrocketed. The ocean acidification is killing coral reefs all around the world. Our energy use is very high and getting higher all the time, especially with all the devices that we use. Tropical forest loss is catastrophic. Water use is a problem, it's not renewable. And fertilizer use is actually a really ways and destroying soil, and so preventing us from being able to feed ourselves. And these two photos, I think, contrast very, very nicely, because in 1980, Shenzhen in China was, beautiful rural area. You can see lots of green, lots of trees. And then 30 years later, it is a gigantic city. And there's a little bit of park on the edge, but you can see just at a glance, the ecosystem services are not really evident in in that major city. And so, of course, what's happening, and I'm sure you're all aware of this, is that short-sighted decisions that satisfy our present-day needs around economic development and a certain standard of living and so on are coming at the expense of long-term considerations, particularly in terms of the health of the planet. And of course, the health of the planet is really going to, it's going to catch up with us sooner or later, and sooner, I think, than later. It's already started, of course. So the population is hugely growing. We're putting more and more pressure on the planet generally. And we all need to eat and we all need to drink. And so, we really are at a tipping point, I think, in many ways. And so, to the extent that humanity has become the primary determinant of Earth's biologic conditions, and this has given rise to a new geological epoch called the Anthropocene. I have a short video I want to show you that very, very eloquently explains a lot of the key concepts to do with the Anthropocene in a pretty short clip. And at this point, really everywhere is affected, and there's nowhere on the planet that is escaping the impacts from rising temperatures and increasingly extreme weather. So already about half the population of the planet, live in areas that are highly vulnerable to climate change, and that includes where I am in Kenya, in East Africa, where millions of people are facing food and water shortages because of climate change, even at current levels of heating. And I can tell you, we've had weeks and weeks and weeks of very, very high temperatures, much higher than usual, with like no rain. So we're at extreme risk of forest fire here. I'm just keeping my fingers crossed. But of course, what's happening is we have a mass die-off of species, from trees to corals. The ecosystems are essentially collapsing. And, even at a 1.5 Celsius increase, okay, there are impacts from that are probably irreversible. And we are not, as according to the latest IPCC report, I mean, there's really no hope for us actually to meet the 1.5 temperature increase. We're going to go way above that to 2, even 3, because we're just not changing fast enough. We're not adapting. And in fact, key ecosystems like specifically the Amazon rainforest and pretty soon the Congo rainforest are losing their ability to absorb carbon dioxide and actually converting from being carbon sinks to carbon sources. All right. Oops, sorry. Okay, I have to stop sharing.
Hi, Paula. Just a quick thing. I think there is no audio. I'm not sure if it is for everyone else. So you might have to unmute and share your screen using audio. Okay, perfect.
Can you hear it now?
Yes, it is a little. Yes, it is a little bit staticky, but I'm not sure if it's just on my end. But we can hear it now, so.
Okay, shall I continue, or because the link is in there?
Yeah, so maybe continue for a bit, and if it is still staticky, we might just have to pass up on this video, and I can share it to the attendees after.
Okay, that's great.
Yes, Paula, I think we might have to skip on it. The audio is not working anymore and it is a bit lagging. So if it's all right with
Okay.
you.
That's totally fine.
Okay, perfect. Thanks so much.
So sorry. I didn't manage to get a reminder on my phone, and so I joined late, I confess. Very sorry. No fault of the organizers.
No worries at all.
So, okay, I really encourage all of you to watch this video. Okay, so let's make sure to share it. And there's another one actually at the end that I would really like for you all to take a few minutes to watch because it's quite inspiring. So one of the fundamental challenges of this, right, is that we aren't all equal in the world. And when it comes to planetary health and climate and environmental change, inequities lie at the heart of the topic. And this picture from Rio de Janeiro really shows nicely the contrast between like a giant favela, right next to all these like gigantic high rises, probably expensive condos. And we have the same thing in Toronto and elsewhere in Canada and, you know, all over the world. And, you know, what we call climate change is a risk multiplier because it multiplies the underlying risks that may exist from, for example, socially mediated threats like war and civil disturbances, displacement and conflict. Poverty increases risk from environmental change through both increased sensitivity to experiencing the effect, but also exposure. So you think of the, you know, the slums perched on the edge of a mountainside, right? And the rain comes, and of course there are no trees left, and the whole mountainside just comes down in a mudslide. And I probably don't need to say, but will, that the impacts on women, children, the elderly, indigenous populations, and pastoral or other traditional ways of life are already far-reaching and are going to become much more so. And I'm sure many of you can think of examples in your community where you can actually see climate change as a risk multiplier in action. So a key concept, though, when we're talking about climate environmental change, okay, is that it is really more than about climate change. And so there's a couple of papers that have been published that call something the planetary boundaries, okay? The planetary boundaries framework identifies those biological and physical processes and systems that are important for the maintenance of Earth's functions that human beings rely on to grow and flourish. It's what we call the safe operating space, okay? These are safe operating limits that have been specified for the planet that we should not go beyond, but are presently doing so. And the planetary boundaries focus on our planet's natural systems and how human activity is changing them, and how changes in these systems can manifest at global, regional, or local levels, but show similar trends, effects, or interactions, and add up to a planetary issue. And substantial changes in these systems can produce rapid, nonlinear, potentially going to be harmful for human development and health. And this shows you what they are. There's 9 of them. And the top 3 are actually climate change, biosphere integrity, land system change, and fresh water use. And the ocean acidification, they're all critical, okay? None of these are not critical. But the climate change one and the biosphere integrity are working, of course, together. A lot of these are working together. And fresh water use and land system change Sorry, where did you lose me?
Freshwater use and land system change.
Okay, that freshwater use and land system change are both cause and consequence of things driving problems with the planetary boundaries and all of them. Okay, so a lot of them are really both cause and consequence. The key point here, of course, is that climate change is not the only problem that we really need to catastrophically immediately be dealing with. So, we cannot continue with the status quo to exploit nature in the same way to provide for a world population that might grow to the end of the century or beyond. And, what happens is, like if you think of the spring, you can pull a spring only so far, right? It'll keep its spring for a while. It won't stretch back. And it's a little bit like that. And we don't even know what's going to actually really happen, because uncertainty is quite characteristic of what we should expect. And nonlinear changes and multiplicative changes, and we really have to come to grips with the fact that our current economic structure globally and nature are not independent in today's world. Environmental threats to human health and human civilization will be characterized by surprise and uncertainty, and our societies face clear and present dangers that require urgent and transformative actions to protect future and present generations. So, in a nutshell, what is planetary health? Well, I'm hoping that you all now understand it's way more than climate change. And put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. So there are a lot of reasons for hope. The interconnected nature of people and the planet mean that there are a lot of solutions that benefit both the planet and human health. And these solutions are within reach. They aren't high tech, and a lot of them aren't expensive. The SDGs address social, economic, and environmental determinants of health very, very deliberately. And as a consequence, really unparalleled opportunities exist for us to change the way we're doing things, the way we're living, globally. And there are a number of really nice case studies available from the Planetary Health Alliance out of Harvard. And the link is there. And I would really encourage you to read these case studies, because they give you a lot of examples of how these solutions actually exist and can be implemented. And then Naomi Klein is a little bit old now, but this changes everything. This is the the preview, if you will, and it's a couple of minutes long. It's very captivating, and hopefully encourages you to rise up and tackle these issues. And we have you, public health specialists, including epidemiologists, and you folks are like ready to, take on the world and make the world a better place. And I really hope that I've managed to encourage you and inspire you just a little bit in that direction. So with that, I will stop talking and give the floor to the esteemed next speaker. Thank you for your patience with me tonight. Bye-bye. Well, I'm not going anywhere. Okay, I'm still here.
Awesome. Thanks so much, Dr. Braitstein. So next we have Dr. Xie. So feel free to share your screen and begin your presentation.
All right, I hope that's working. Is that the right screen that I'm sharing? Okay, fantastic. So thank you so much, Dr. Braitstein, and to the organizers. I'm really delighted to be joining today. And I'll start by saying that I've come to the issue of planetary health through a slightly different lens, through the lens of a clinician and the framework of global health, which you saw in Dr. Braitstein's diagram. And I have probably less experience than my fellow speakers, but a few years ago, I did work in a conflict zone where severe drought converge with social inequality to create conditions for the mass displacement of people, followed by a humanitarian crisis. And it became quite clear to me that we are in extreme danger of seeing more of these scenarios play out in the near term, let alone over the next century. My global health lens is, it probably centers humans a little more than planetary health does. I like the definition from pediatrician Sebastian Taylor. He suggests that global health is characterized by health as an intrinsic social good, equitably generated within and across populations. And the two key phrases for me there are intrinsic social good and equitably generated. So the focus of my presentation will be the inequitable health impacts of climate change, and also why social inequality matters for planetary health. And it's so great that I'm following Dr. Braitstein's presentation, because I'm going to start globally and move local, and I'm going to use this diagram to illustrate some of what Paula covered. You've probably seen this type of donut diagram before. It shows two critical planetary health boundaries as green circles, the dark green circles. The outer one is an ecological ceiling, and the inner one is a social floor with universal goods such as education, health, nutrition, life expectancy, sanitation, and social equality as well. Ideally, we live in the green space between these two circles, having good relations, living well, not consuming more than necessary. But the reality are the red bits. On the outside are the current global overshoots of the ecological ceiling. On the inside are shortfalls in the social foundation. And globally, we're dealing with many deficits in basic health and social needs, while at the same time living beyond what the planet can sustain. And just as Dr. Braitstein said, but of course, there's a big gap between where emissions, pollution, and over-extraction are coming from and who gets harmed by them. And I'm going to take the next 10 minutes to consider reasons for this inequality. But first, because I promised to cover too much in 10 minutes, and because many of the shortfalls are mediated or intensified by climate change, a very, very quick review of the health effects of climate change. This is from the latest IPCC summary, where they've highlighted adverse effects by infectious diseases, heat, malnutrition, mental health, and displacement. And I'm sure it comes as no surprise. So I won't dwell on it except for a very quick example, but you can see from what they've assessed here, basically it's bad on all counts everywhere. So my example is just going to be for dengue. Dengue is spread by mosquitoes, such as this one. I hope I got the right one. And the disease is endemic or regularly found in certain areas, but not found in others. So the mosquitoes are not usually able to transmit dengue above certain altitudes or latitudes, but their range and activity is sensitive to climate conditions such as temperature and humidity. And so with warming, the range of the mosquito can expand, for example, up to higher altitudes. And now people living in this orange zone are newly exposed to dengue. And we're seeing similar shifts, not up mountains necessarily, but similar shifts are happening for malaria, for Lyme, cholera, and other infectious diseases, where there can be a range expansion, higher transmission, or increased human susceptibility, for example, because of more flooding, water scarcity, migration, poverty, and urbanization. And infectious diseases and myriad other impacts of climate change are undoing improvements in people's lives everywhere. Behind this quote, though, we can see that the pattern of impacts and risks is quite unevenly distributed. And this map shows regions of greatest risk for climate change based on a number of factors. The darker the red, the greater the risk from climate change at a national level, at a national average. You can see that Canada on average is relatively low risk compared to other places. But we're still seeing and feeling the health effects of climate change here, including increasing exposure to diseases, heat waves, wildfires, and damage to health and social infrastructure. You're seeing that on the right side of this diagram. The Western Canada heat dome, for example, last summer was estimated to be 150 times more likely to due to climate change. The pattern of these harms in Canada also looks a lot like that global distribution that I showed. They share a lot of features with who was affected by COVID-19 pandemic, for example. We can see that in some more maps. So I'm sure we're all aware that COVID-19 exposes existing inequities in health and its determinants. This is probably a familiar map of Toronto where the darker blue indicates areas where there have been more cases of COVID-19. And what really stands out for me is how similar this map looks to one showing areas of marginalization in the area as well. And on this issue, Dr. Arjuman Siddiqui, the division head of epidemiology here at U of T, said to the House of Commons Standing Committee on Health that Canada is structured in a way that has placed the burden of risk for COVID-19 squarely on the shoulders and lungs of marginalized people. And when we look at how rising temperatures affect people, it's not only in the global context, but also in our neighborhoods where inequities lie. It may be accurate to say that Canada is structured in a way that's placed the burden of climate change squarely on the shoulders of marginalized people as well. We can see that these shared inequities among climate change, COVID-19, and social systems are linked. And if health is an intrinsic social good, social inequities also need to be addressed. And that's exactly the type of thing that I see in the ER. One of the patients that sticks out in my mind was an elderly woman who was rushed in after collapsing at home during a heat wave. She lived alone in an apartment. She couldn't afford air conditioning and used a walker to get around. So it's hard for her to go somewhere to cool off. In her case, it is, and in many people's case, it's both health and social factors that make folks more vulnerable. They may interact to make it harder to lead a healthy life, work in a safe and reliable job, get access to healthcare, or even to have clean water. And that's, I'm talking not just in Toronto, of course. In Canada, for rural populations, for example, they might rely on groundwater, and they're more likely to be contaminated by bacteria in higher heat and heavier rains. And over 40 First Nations communities across Canada still don't have access to safe drinking water long-term. Going back to my patient, what would have made her safer? It would have been, for example, better housing with insulation and natural shade to keep her home cooler, adequate income so she could afford air conditioning or a fan, and more social connections so that she had someone to check on her. We've learned from COVID-19 quite starkly that social factors are so influential despite our universal healthcare system, and health is not equitably generated, maintained, or promoted despite that. So I'm going to give some more examples focusing on financial resources. This is data from StatsCan broken down by income quintiles along the bottom. It's a graph of contact with a doctor in the past year for children. And on the left are families with the lowest income going to the highest income, moving towards the right. And yeah, there are many different explanations for this, but you can see that there's a clear difference going from the poorest families to the richest. This one is for dental visits for children as well by income, and we see the same pattern. Dental care is not included in our universal healthcare system, so the gradient here is even starker. And this last one is for pap smear testing. And again, we see the same pattern. So when we think about the impacts of income on health, we should also link that with who bears the burden of higher economic costs from climate change and from COVID-19. If there is an economic shock like a pandemic, who's going to lose income and not have any backup? This is a graph of who's eligible for employment insurance in Canada, and it's people who are in less than $15 an hour and women who are disproportionately lacking protection. So the context that we live in is that there's a great deal of wealth disparity in Canada. The top 10% of households, for example, have more than half of the total wealth. It's important to keep in mind these gradients because if climate change impacts marginalized people the most, this inequality can become amplified. And I think this UN report actually does a really great job of explaining why. So climate hazards feed a vicious cycle where inequality is reinforced through disproportionate impacts on disadvantaged groups. And this graphic adds a key point that inequality also skews policies towards more climate change itself. And how does that happen? Well, first, disadvantaged people and groups will be left with fewer resources. Second, groups with more power can influence policies, which leaves fewer resources to pay for the basics, that social foundation that we all need and enjoy, such as public health, clean air, good schools. And in the end, this generates vulnerability. So instead of generating health and well-being, it makes people worse off. And coming back to this donut, I'll summarize that by saying that we need to consider the social, political, and economic factors fueling human-induced climate change and ecological degradation because they are human-induced. The problems with inequality are twofold. One, that some people will be disproportionately harmed, and two, that we're going to miss out on resources that we might otherwise have to fight climate change or improve health when our natural, financial, and human resources are concentrated in the areas that don't contribute to social benefits, which is why inequality and social and political and economic concerns matter for public health. The Ottawa Charter had the prescience of emphasizing this nearly 40 years ago, which I thought was quite amazing. To conclude, climate change has unequal impacts. Social inequality is also a driver of climate change, ecological degradation, and poor health. So if we care about the planet and we care about health, we need to address the common social challenges to both. And I will end there. I'm going to hand it back to the organizers.
Awesome. Thanks so much, Dr. Shia. It was very insightful. Next up, we will have Carlos. So Carlos, feel free to start sharing your screen.
Of course, can you see my slides now?
Yeah.
Perfect. Well, thank you for having me with you today on this panel. I am here to talk with you about the complexities of engaging multiple ways of knowing in planetary health. For this purpose, the first question that I want to invite us to consider is, why should we engage multiple ways of knowing in this field? Two key documents on planetary health education can give us some answers. The first quote on this slide comes from an educational framework published by the Planetary Health Alliance. This document acknowledges that Indigenous peoples and other communities have long appreciated the interconnections between humans and nature. Indeed, such interconnections are placed at the core of the whole framework. The second example comes from a consensus statement produced by the Association of Medical Education in Europe. This paper admits that Western medical practice has overlooked the knowledges of non-Western communities, and that such knowledges could offer valuable lessons for planetary health practice and education. Up to this point, we have discussed that it is important to learn from non-Western knowledges in planetary health because, number one, Indigenous and other non-Western knowledges have important insights on the interrelationships between humans and nature, and number two, because medicine and other sciences have historically failed to appreciate the contributions of non-Western knowledges. Now, the goals to engage non-Western knowledges in planetary health education, and perhaps more broadly, are often framed in well-intentioned, forward-looking ways, as the graphic design of this slide may evoke. But how ready are those of us educated in Western sciences to learn from non-Western knowledges? In the last few months, I have been learning from Indigenous and post-colonial scholars whose work illuminates the complexities of sharing knowledge across knowledge systems. It is precisely the contributions of these scholars which make me think this journey is not that easy. Take, for instance, the influential work of Cree scholar Willie Ermine on the ethical space and its application to knowledge translation in collaboration with Dr. Janet Smiley. The idea of the ethical space helps us imagine a theoretical space that is open when two people or knowledge systems come together. On this slide, we can see two independent circles, one of them representing the knowledge contained within Western science, and the other representing Cree knowledges. The circles are separated from each other because each circle is claiming their own distinct and autonomous view of the world. When the two circles come together for the purpose of sharing knowledge, there's a space that is open between them, which is represented on this slide as the intersection of the two circles. This space can be ethical if the two parties are committed to not infringing on the space of the other. In this way, sharing knowledge becomes an opportunity for mutual learning and transformation. However, this in-between space can also work in unethical ways that reproduce violent relationships among knowledge systems. For example, if you follow the top arrow, which symbolizes the transmission of Western knowledges and categories into the space of Cree knowledges, this transfer can constitute an act of colonialism. A colonial relationship will happen when Western ideas are deemed universal and are simply imposed into Cree realities without due consideration of Cree contexts and worldview. In the opposite direction, attempting to bring Cree knowledge to Western science will constitute an act of appropriation if Cree knowledges are separated from their originating context and then reinterpreted through a Western view of reality, knowledge, and relationships. Overall, the concept of the ethical space can help us appreciate how things may go well or wrong when we try to share knowledge across knowledge systems. But what are the assumptions of Western science that make it difficult to establish an ethical space? And what are the implications of these assumptions for planetary health? To explore these questions, let us go through a brief journey to the origins of Western science. I want us to reflect on the emergence of a civilization project that is commonly described as modernity. Modernity is a civilization project because it prescribes assumptions about what it means to be human, what is real, and what is it that we should desire and strive for. There are many accounts of what modernity is and its key temporal moments. Explanations of modernity that center on Europe tend to locate the consolidation of modernity during the Enlightenment or the Age of Reason. At this point in history, the ideals of the Enlightenment were affirmed in response to the dominance of religious powers, knowledges, and forms of governance. Ideals such as the use of reason, human happiness, the separation between religion and government, and the desire for progress were emphasized during the Enlightenment. There are other explanations that state that we should not think about modernity as something that happened within Europe. Rather, the ideals of modernity should always be paired with colonialism, empires, slavery, and resource extraction in the Americas, Africa, Asia, and Oceania to better understand the conditions that made possible the rise and expansion of capitalism, nation states, and Western science throughout the world. Despite emerging centuries ago, modernity continues to frame the way we think about the world and the kinds of things we desire. This slide lists some of the assumptions that we tend to carry through modernity and yet are often invisible to us. Such ideas includes a knowable reality that can be described through language and reason, science as the means for truth-making, humans as being separate from nature, the desire of engineering social progress through science and technology, and the drive to accumulate wealth through the exploitation of humans and nature. To help us see the implications of modern thought for planetary health, it is helpful to take a closer look at how modernity has made sense of reality by dividing it through language. To help us in this task, think of words as boxes that divide reality. Modernity has created several boxes that act as binaries, with one end being more valuable than the other. The first binary that we can talk about is that between reason and the world. Modernity affirms that reason is the most legitimate tool for knowing the world. Within modernity, we can think of ourselves as boxheads. We think so much with our heads that we have overdeveloped this capacity. When we live in the world as boxheads, we tend to project our own desires for progress, certainty, and control through the knowledges we create. Contrastingly, the capacities of our body to sense, know, and engage with the world remain underdeveloped, including our sense of connection with the wider living metabolism that is the Earth. When we speak about engaging non-Western ways of knowing in planetary health, Boxhead can help us imagine the potential gifts of non-Western ways of knowing. Such ways of knowing may be better equipped to use the body to know with the world and not about it. Additionally, non-Western ways of knowing may help us to engage with knowledges that do not come from humans. This takes us to our next binary. Modernity sees humans as exceptional beings who are uniquely equipped to know the world through rational thinking. Such assumptions establish a separation between humans as the knowers and nature as that which is known. This division also creates a hierarchy in which humans are considered superior to nature and entitled to control it. Science, technology, and development become our tools to exert control over nature. In the context of planetary health, aiming to see humans as part and not separate from nature is an outstanding goal. However, if Western science has worked for centuries under the assumptions that humans and nature are separate entities, then bridging this binary through our work in planetary health may be a harder journey than it looks like at first sight. It is important to note that within modernity, the category of human is supposed to be universal, yet it was created with the white European man in mind. As an illustration, let us remember the colonial debates on whether indigenous peoples had souls or were human. Additionally, the division between the colonizer and the other was linked to the previous binary. Indigenous peoples were seen as being closer to nature and further from reason and humanness. It is precisely for being closer to nature and further from reason that indigenous and other non-Western knowledges were dismissed by Western science, which leads us to our last binary. The binary between science and beliefs. The emphasis on reason placed science as the most sophisticated form of knowledge. Within Europe, scientific knowledges had their counterpart in lay beliefs, opinions, and religious knowledges. At the peripheries, in the colonies, non-Western ways of knowing could barely count as knowledge. Science's self-assigned monopoly over truth makes it difficult for us to respectfully learn from non-Western ways of knowing in planetary health. Modern thinking will lead us to read non-Western knowledges through our own assumptions about reality and pick and choose knowledges that are compatible with our findings, theoretical frameworks, and agendas. In the previous section of this presentation, I introduced many ideas that may feel new to you. So let's do a quick summary before we move on to the end of this presentation. Our journey to the history of Western science reminded us of the Enlightenment period, the rise of colonial empires, and how their legacies are still here with us today. We also explored some of the binaries that are essential to modern Western thinking. These binaries help us to make visible limitations that Western science may have when attempting to advance the field of planetary health in collaboration with multiple ways of knowing. Such limitations include the projection of Western views of reality through science, the tendency to see humans and reason as separate from nature, and the dismissal of non-Western knowledges for being closer to nature and further from reason. It is important to highlight that my presentation does not seek to discredit the field of planetary health or Western science. Quite the opposite. Fields like planetary health can help us advocate for respectful engagements with non-Western knowledges and with all beings on Earth. That said, the key message of my presentation so far is that for those of us trained in Western education and science, we have a long way to go before we can respectfully learn from indigenous nations and communities from the global South. Fortunately, we're not alone in this journey. Indigenous and post-colonial scholars have shared many ideas and principles for working with each other across knowledge systems. These include the ethical space that we mentioned in the first part of the presentation, the Mi'kmaq principle of Edwg or two-eyed seeing, which is very popular in the health sciences, and the ecologies of knowledges. Unfortunately, explaining these ideas is out of the scope of this presentation, but I can share with you some similarities that I have noticed in my learning from these scholars and knowledge keepers. The three ideas that I showed you on the previous slide take as a starting point that there exist multiple ways of knowing and being in the world. Each way of knowing has developed in a specific context. This means that all ways of knowing are local and none is universal. We can only learn from each other if we accept that the knowledge systems that we are part of are necessarily incomplete, unable and unwilling to apprehend all of reality. Incompleteness also helps us not romanticize or idealize any knowledge system, whether modern science or non-Western knowledges. Because all knowledge systems are incomplete, and each one brings a different set of gifts, strengths, and limitations, all knowledge systems are valuable and have a potential role to play in contributing toward planetary health. To end, I invite you to consider, what boxes are fundamental to your research? What knowledge traditions are you in contact with? And how have you learned from them? Thank you so much for your time, and I look forward to our conversation.
Thank you so much, Carlos. And next up, we have Dr. Talukder. Feel free to start sharing your screen.
Just a moment. Oh, yeah. So can you see it now?
Yes, we can.
Okay then, yeah, good. Yeah, just I need a little bit work here actually. Well, yeah, I think that the the platform is set for me. And thank you, the previous panelist, for setting the definition of planetary health very well, as well as also the research areas, and as well as also the other issues of the planetary health. So at the outset of my presentation, just let me introduce myself. It is already said, but again, I'm Byomkesh Talukder, working as a Planetary Health Fellow at Dadal Institute for Global Health Research. And my presentation is on planetary health perspective in the dynamic nexus of climate change and health and agricultural systems. So since planetary health is already defined, so but I just want to show this slide that our health actually is hugely depends on many internal factors for an external factor. For an example, agriculture, climate, soil, energy, water, and oceans. So today I will show that how this external factor, that is agriculture and climate, they are intersecting each other and having an impact on our health. So let me show this slide to you. This is actually the intersection of agriculture at the sphere of biosphere, geosphere, hydrosphere, atmosphere, and cryosphere. So the agriculture is actually happening in the intersection of all spheres. We need atmosphere, we need hydrosphere, cryosphere, geosphere, and biosphere across the world. And without that, we cannot do agriculture. This is already been shown, so I'm not showing it. But in this slide, if you see that the carbon emission is increasing, ocean acidification, as it is said before, and also fertilizer is increasing, this is all actually happening using of natural resources in food production and also agricultural system. And also if you look at our food production system and also the land use, you will see that humans are using 55% land of the the land surface for agriculture purpose, and for that 50% of agriculture, actually 77% is used for livestock, meat, and dairy, and also only 23% actually used for crop production. But when you see that 77% land actually agricultural land used for the meat, dairy, and livestock, we are getting only 18% calorie and 37% calories from them. And then biodiversity is declining, and also the temperature is increasing. Now, since this temperature is increasing, the world is actually facing two types of events. One is slow onset events, another is extreme events. Under the slow onset events, it is actually sea level rise, desertification, increasing temperature, land and forest degradation, loss of biodiversity, glacier retreat, and ocean acidification. Whereas in extreme weather event, storm surge, tropical cyclone, drought, flood, and heat wave. And I will show you in my next slide that how the increasing of temperature actually will have impact on agriculture. This is the IPCC, this is the example that in every increment of global warming, that will have impact on regional mean temperature. And that will also have impact on regional precipitation, as well as also regional soil moisture. Now, mean temperature, mean precipitation, and mean soil moisture is really important to do agriculture in a very sound way. But our world is actually having these abnormalities around the world. And along with that, the world is facing a water crisis. And if you see the high water stress, the red one, and also another red one, extremely high water stress, you will see that all the tropical and subtropical countries actually in that high stress area, as well as also we saw in previous maps, they are also having the issues of mean temperature, moisture, and precipitation. And then there is also issue of deforestation that is actually happening across the globe, and especially in tropical and subtropical countries, and that is also having impact on our agriculture. And there is also the flood risks because of climate change and heavy precipitation, and also shifting of many earth systems, and that is also having impact on tropical and subtropical countries. And by the way, in these tropical and subtropical countries, most of the developing countries and also most poor and middle class people are living. And another issue that is actually happening around the world, that is actually changing of tropical cyclone, and it is actually moving towards the polar. And the tropical cyclone's intensity is so huge that it is actually bringing a lot of havoc and destruction in the agricultural system. And another issue that is actually really alarming for everybody, that is sea level rise. And sea level rise actually bringing salinity in the land and making land actually unfertile, and it is actually becoming very difficult for the farmers to do agriculture in saline water. And you can see from this map that along the coastal areas all around the world, sea level actually is rising, and the agriculture in the coastal areas is going to be hampered a lot. And then the desertification that is also happening around the world, especially in tropical and subtropical countries, alarming. And another problem is the glacier retreat, and that is actually happening in Indian subcontinent, as well as also South Africa and also in Africa. And as a result, the world actually is losing 1 to 2.3 million hectares of agricultural land because of the soil degradation annually, because all those events like extreme weather events and also slow onset events, they are actually degrading our soil. And another really big concern, that is many systems of the earth that is moving towards actually tipping points. Most notable example can be the Indian monsoon shift. And you know that the farmers of Indian subcontinent really depends on the monsoon, and also most of their agriculture actually rain-fed irrigation system. Since the monsoon is shifting, so their crop calendar is shifting. As a result, farmers is finding really hard time to adapt with the changing monsoon pattern, as well as also increasing temperature, and as well as also glacier retreat. But in that condition, it is already shown before, but I also want to say that our people will be like 9.6 billion by 2050, and we need actually 4.2 billion more crops to feed those amount of people. But due to all type of slow and onset event as well as extreme events, our land is actually changing, and they are altering in a way that many places of the earth will be abandoned, and farmers cannot grow crops in those areas. And this is another map that is actually showing that by 2050, how the world, the cereal grain will decrease. And if you see this map, you will see that mostly tropical and subtropical countries, people, they are actually in this belt. They will have a lot of issue, not have enough cereal yield, and as a result, they will face the food security and other kind of food security related health issues. And it is said that food insecurity increased by 2 to 5% with each flood and drought. So since drought and flood will keep happening each year, so we can say that this is going to affect the overall food security of the world. So we did actually literature review to understand that how land degradation from different extreme and slow onset events is actually having on food security and yield of the crops. And we actually found that, yes, it is actually happening around the world, and it is already mentioned in many scientific research, along with other environmental impact and also the health impacts. And then another problem that will also have impact in our food and agriculture system, that is related with the climate change. This is actually changing the ecology of the pollinators. And the pollinators, they are extremely important for our food and agricultural systems. They are actually helping 70% of crops producing fruits and seeds to pollinate, and also they are playing huge role in maintaining biodiversity, as well as maintaining the ecosystem, as well as also increase food production. But since the pollinators ecology is going to hamper, as well as also they are affected by various disease and other environmental adverse effects, so the pollinator is going to decrease, and that is actually have a serious impact in our food production. Not only the pollinator, there is another problem that is actually coming with climate, increase of temperature and changing of climate pattern around the world, that is industrial spread. And in a recent UN study, it is found that many part of the world, many cereal crops or main crops will be impacted by the invasive pest. And this recent locust swarms in Africa, and then it's moved towards the India and any Middle East countries, that actually show that how dangerous it is and how it can actually destroy crops hectares after hectares, and that can actually lead serious food insecurity in many parts of the world. Not only the crops and food production is going to be impacted by the impact of climate change, but increasing of temperatures is going to have a serious impact on protein, iron, and zinc content of many crops like wheat, rice, barley, potatoes, soybean, and vegetables. And this is actually going to be a serious concern for the child micronutrient deficiency as well as their child health. And this is also related with their immunity system. So they, while they're actually having this food as their main food or principal crops, and then what will happen actually, because of this deficiency, they will be malnourished, and then there will be other type of disease among them. And this is actually going a very serious problem in many countries, especially North America, South Asia, and Sub-Saharan African countries, where the population heavily depends on potato, maize, rice, wheat, and other crops as the main item of their food. So this is really a big concern for everybody. That is not actually talked often, but really a big issue from the health perspective. Another problem that is climate change is going to unpack the burden on food safety in a variety of ways and in pathways. And in fact, it is changing the pathogen growth and survival, as well as it is also because of the climate change and increase of flood, it's contamination of crops by phases due to the high level of rainfall and flooding. And in many ways, it is actually going to hamper the crops, like increasing mycotoxin and or other foodborne or food-related pathogens, those kind of things, and also the zoonotic disease. As a result, what will happen? The farmer will use more pesticide and more insecticide and fungal pollution that will increase pesticide use, and as well that will have environmental impact and also the health impact. Not only in the land that is actually hampering due to impact of climate change, but as well as also our fish resources, and ocean is our main place to collect fish. That the fish resources in tropical and subtropical countries, they are actually changing their habitat and moving towards the polar region because of extreme heat. And we did actually literature review, and we found that because of ocean acidification, warming ocean, and oxygen oxygenation, the ecosystem is changing, as well as that is also leading for food and nutritional security, livelihood, pathogen organism, biomedical, pharmaceuticals, and disaster risks. So what will happen, since our food and agriculture system is going to be impacted severely by the climate change, and then also the food diversity is going to be disappear, then what we are talking that the planetary health diet that is actually essential for a good life and disease-free life, I think that is going to be also hampered, because you cannot actually have all those these food items that is actually essential to maintain a planetary healthy diet. Not only the agriculture production is going to be hampered by the increase of temperature, but also the producers. If you look at this map, you will see that most of the smallholder farmers, they are living in tropical and subtropical countries, and tropical and subtropical countries temperature is increasing. As a result, the smallholder farmers, including man and female, they are going to have their communicable disease increasing. They are exposing to the non-communicable disease, mental health, and occupational health, safety, and other health cities. And remember, these smallholder farmers actually producing 80% diversified crops of the world. So their role is huge to maintain the food-related health and other things. While the farmers is having different, health issues because of the climate change, they are also having a lot of mental pressures, because often their crops are destroyed by the extreme and slow onset events. And these are very marginalized people and poor people. So they don't have enough support or subsidies. As a result, they are always in mental tension and they're having a mental pressure. And this is already evident in many parts of India. Not only food, hampering food agriculture system by climate change will actually have those kind of impact on health, but this will also trigger the migration and as well as also in conflict. From this map, you will see that it is already showed that due to the decline of food production in many part of the world, for an example, South and Southeast Asia and Sub-Saharan Africa, and also South America, there will be a issue of migration and conflict. And remember, in 2009, 43.3 million people were forcibly migrated, and in 2018, it was 70.8 million migrants. So we can expect that due to decrease in crop production, as well as also the different issues in agriculture systems, this migration will increase. And this will also have another impact on the world hunger situation. And you can see in the tropical and subtropical countries, in 2020, world hunger actually remaining 15 to 35%. So we can easily see that if temperature keep increasing and then all the slow and onset events keep happening, so this hunger will actually increase, and then there will be a chronic hunger. Not only developing country or the poor countries, there is going to be impact, but as well as Canada is also going to impact. Canada is already having a lot of adverse effect of climate change, like reducing ice cover, permafrost degradation, increased pests, reduced glacier, low Great Lake water, incident of drought, sea level rise, and so forth. And remember, in Canada, according to the 2006 statistics, there are a issue of child food insecurity and at household level, and it varies across the province from 15 to 72%. And these things, as well as other food security issues, I think is going to be a serious problem in Canada too. And the very important fact about agriculture, food and agriculture systems, that while we are producing enough food, but 811 million people is still hungry, 3 billion people cannot afford a healthy diet, and 33% of global food produce is lost or waste. And agribusiness accounts 70% global freshwater use, and 2 to 70% human origin greenhouse gas actually coming from agriculture sector. In this context, if we see the relation of food and agriculture system with sustainable development goals, we see that it actually has relation with all the 17 goals. And if food and agriculture system actually hampered by climate change, our initiative to achieve the sustainable development is going to be seriously hampered, as well as also since agriculture playing a very crucial role and influencing genetic diversity and also functional diversity, land use change, and also the biophysical chemical flows, that is going to be a serious problem for our planetary health. That means that is going to hamper overall human livable condition of the earth. Keeping all those things in mind, in recent UN food system, they have actually identified 5 action trackers to address the health climate change impact on food and agriculture system, that is access to safe and nutritious food for all, sustainable consumption, nature positive production, livelihood and equity, and resilience. But since the climate change is keep happening and temperature is keep increasing, this will be a serious problem. And so that's why to achieve all those actions, so what we should do actually, we need a local level, regional, national level, and also the global level cooperation. We need collaborative research, and we should create a database, analyze them, model them, and understand what will be the impact and how they are going to impact the health of the people. And what we can do, we can develop a lighthouse project, and we can also have to sit with different stakeholders like politicians and keep them learning that this is a serious problem. Another issue that is really important in this context is global South and global North collaboration. Climate change, it is not an issue of a global South. It is also issue of global North too. And before this IPCC report, in 2020's IPCC report, it was always thought that the developing countries, they need adaptation and also the mitigation. But now the developed countries, they also need adaptation. They also need to know how to adapt in food and agricultural system to face this problem across the world. And we are actually interconnected. So everybody is actually interconnected, and our country's food system, Canadian food system, many people of the world depends on Canadian food system. And again, in the same way, Canada's food system also depends on many countries' food system too. So that means we have to collaborate. We have to share our global data technology. We have to apply ICT. We have best practice. We have to peer learning, and we have to find mitigation knowledge to address these problems. So in conclusion, I will say that we have to collaborate globally to address these problems. So thank you very much. If you have any question, I'll be happy to share with you.
Thank you so much, Dr. Talukder, and all the speakers. I will pass it on to Megan, and now we will have a little bit of a Q&A sessions. Thank you so much to the viewers who were generating some questions throughout, and some have already been answered by Paula and Edward, but we will also, some of them are pretty general and across all topics that were discussed, so we will address some of them again. But yeah, I'll pass it on to Megan, and if you have, if the viewers have further questions throughout this Q&A, feel free to drop them in the chat or the Q&A box as well, and we will be sure if we have time to answer that as well.
Yes, thank you. I see a lot of good discussion and questions in the Q&A. I do have some I pulled from that about some general questions, so we can do this maybe popcorn style for our panelists. But one question for general is, what can we do on an individual level to help support planetary health? To open to our speakers, maybe one can start it off for us. Yeah, Carlos?
Yes, thank you so much, Megan. First of all, I wanted to thank you, Infectious Disease Working Group, for the wonderful job in organizing this event. To all the panelists, I think we were complementing each other very well, so it was wonderful to hear you. And yes, I want to address this question of what can we do at an individual level, and also tie my response with the question about what can we do to help marginalized communities. And I think something to do at an individual level with a planetary health lens in mind is that we need to think about our interconnections with all people and with the planet. And so, for example, when we start thinking about how to help others to cope with the environment, one of our initial reactions may be, oh, we really need to help focus on helping marginalized communities to cope with climate change. But if we start noticing what are the trends by income on how much we're contributing to climate change, we will notice that the higher income of the country or the higher income of the segment of the population, actually our lifestyles are more carbon intensive, and that other communities that we might tend to see as marginalized because they're farmers or peasants, their living styles are actually very low on carbon. And so when we think about the theory, how we think about climate change, we mentioned in some of the presentations the Anthropocene, of really knowing how humans have impacted the earth, but it is not all humans who are impacting the earth equally. There's another term that is called the Capitalocene, naming that it is our mode of production that is consistently harming the earth. This does not mean that we cannot do anything inside of capitalism to address the problem. There are many things that we can do, but we also need to consider when thinking about, for example, the Sustainable Development Goals, that sustainability in one place in the world sometimes is subsidized by not sustainability in other parts. For example, let's think about waste management, what happens to the trash in Canada, and how a lot of the residues are being sent to other countries in the world. And so we have a sustainable Canada, but an unsustainable global South. So I would stop with that, and thank you so much for the opportunity to speak again.
Thank you. Edward, did you have a comment too?
Yeah, thanks so much for that question. And I'm going to tackle both as well. And I think it's really nice to follow up with what Carlos said. On the first point, I actually really like the mantra used by the Sunrise Movement. And they say the biggest driver of emissions is the political power of the fossil fuel industry, not individual behavior. And so, potentially one way to address the issue of marginalization as well is a shift towards more participatory and democratic forms of power so that governments are held less to account by private industries and more rather by the public interest. And there's recent studies that have shown how industry has hidden the cost of burning fossil fuels, much like how tobacco companies hide the harms of smoking. And I think this also gets to related to Carlos's point about valuing and supporting the self-determination of marginalized communities, and finding ways of supporting substantive freedoms more than just formal freedoms. So, for example, this addresses the third question, but many of us currently don't have the freedom to not fill up our cars with gas, even though it's very expensive, especially for people who are marginalized. And part of the reason why we think gas is very expensive is because of public subsidies that make it cheap usually. If we were paying the true cost of gas, including its extraction costs, contingent on colonization and environmental destruction, it would cost a lot more. So that's potentially a lot of money that could go towards more sustainable jobs or towards better standards of living or compensation for people who've been harmed by extractive practices. And as I hopefully have shown, highly intensive resource use is also highly inefficient for health and well-being. And so I guess to wrap everything up, I think we do need to shift towards more non-materialistic forms of satisfying needs, including universal basic services like we've done with roads, schools, healthcare, why not medicines, food, housing, and transportation.
Yeah, great comments. And just to follow up with that point there, the attendees also want to know if you have any suggestions in terms of interacting with the government on the climate change issue. One question was, does writing to our officials help, or is there another way that any of you would suggest?
I think that's a very critical question, actually, that how you can influence government. Yeah, there are many ways actually, I think, doing that. The awareness is actually really important. While we are talking about the climate change, it is already, I think in a survey, it is found that only 30% people actually are aware about what is climate change is. That is really a big problem. And the rest 70% people of the world, they don't understand what would be the impact of climate change. And another problem that I actually, according to my observation, that when we are talking about that all these CEO and other things, all these multi-million company or gas company or oil company, whatever you say, if you see that their CEO actually MBA holder. Now in MBA, that in business, they never taught this climate change and also the ecological degradation and their relation with health and other things. And they are actually, their course and everything is designed in a way that maximum profit. So whenever they are actually, whatever they are doing, or in terms of corporate social responsibility, or recently that ESG, environment, society, and government's reporting, they are always keeping that in mind that I have to make maximum profit. So that is also a big problem. So now I think that all the world companies, all the world leaders, and they are also to some extent influencing the politician or political leader, because they are actually supporting the political parties' funding and other things. So their opinion, their policies also reflected in the political parties' agenda, as well as also their party's mandate during the election. So that's why I think that in education system we have to bring this kind of subject in, like MBA, law, and other subject. They are actually huge influence over the decision making. That is important. But it is good things that doctors now realized that the environment and health, they are interconnected. So not only we have to external, health factor is important, as well as also external factors. That I always, appreciate that doctor is now realizing it. But before, like 10 years or 20 years ago, it was actually totally separated. It was in silo. Only the environmental science or subject like geography or other subjects, they were studying that there is an issue of environmental health or eco health and One Health. And so that is another problem. And another problem that I found, that when we are talking about planetary health, there are many concepts like One Health, planetary health, eco health, environmental health, geo health. And I found this is actually problematic. If you want to, pass this message that, look, we are in serious crisis, our earth system is deteriorating, and we are actually in the middle of the survival of the human species. So we have to actually bring everything in the same word, not jargoning so many, not putting so many jargon in front of the policymakers and in front of the common people and making it so complicated. I found in One Health, only the veterinary surgeon is working. There is no, the medical doctor and other like ecologist or other people. So this is actually a big problem. So we have to change our education systems. As an individual, I think we have to advocate these things. We have to actually, shout about these kind of things, that it is actually need for the survival of the human. I think that is the best way right now to approach it. Thank you.
Yeah, thank you for that answer. And just for the sake of time here, we do have one more question. I know that there's a lot of questions in the chats that are for individual speakers. So if you wanted to also message there live, we will also be sending an email, everyone's emails, the panel's emails. If you have direct questions, you can send it to them as well. But to wrap it up here for all our panelists, the viewers do want to know what keeps you motivated and hopeful for the future in this field. What are your reasons for hope? So maybe we can start off with one of our panelists here.
Well, I answered this in the chat, but it is really, really important. And I've struggled with it on a really personal level. And so, I mean, I could talk for quite a while about it, but first of all, honestly, you all gives me hope, truly. Younger generations really do have a lot of inspiring intelligence, ideas, energy, motivation. Nobody has to convince you that climate change is a problem. You get that. You're ready to okay, this is the problem. Now let's move ahead and deal with it. That gives me a lot of hope. The other thing that gives me a lot of hope is nature, because nature itself is so resilient if we just give it a chance. And so when I go out into nature and I take the time to smell the flowers and listen to the birds and, see trees growing and, and I do my bit to try and help nature along. And if we all just do our little bit, right, it can make a gigantic difference. Now, of course, there's the whole fossil fuel industry and all of that. And some of that we can have some influence, but a lot of it, it's really hard for us as consumers to have influence. And we need hope every day. Every day we need hope. And, despair, I don't really believe in the devil, but, despair is like the tool of the devil. Despair brings you down really, really fast. It is so important to have some hope and optimism. And so whatever it is that inspires you, whether it's talking with people, being in nature, mindfulness, meditation, reading, all of it, use it and cultivate it for yourself and contemplate it mindfully, how to cultivate hope in your lives, because it is really essential for moving forward.
Thank you for that comment. Did others want to add on to that?
Yeah, I agree with everything Dr. Braitstein said, and I'll say for myself, it's really finding a community of people who have similar interests, who have support, and also very importantly, people to learn from, as she said, and be inspired by. I think that's just very important for me.
Awesome.
And one more last comment is to not listen to all the old farts who are like, oh, it's hopeless. Yeah, there's no hope for the world. It's all, certainly with an attitude like that, there is no hope, right? You got to cultivate it, got to work at it. And, whatever doesn't work for you, just let it go. Just don't listen to it. Don't internalize it.
I just want to add one thing here. I think that human has advanced in technologically so high, and we know the problem. So, but human in past, we are very good at portraying the issues and risks and other things, but we need action now. Because we always talking about the risks and all the bad things. But under those bad things, how we can actually convert those risks in a positive way, and how we can bring like equity, as it is said, all across the world. Those things is really important. And now just think about the passing of information and also knowledge. Right now, it has become a global knowledge. In any country, by clicking internet, can get that what actually Canada is doing. Now the question is how to implement that knowledge to solve their local problem. That is actually real issue. But I'm hopeful humans are the most adaptive animals in the world, and for their own survival, I hope they will do something to to change everything, maybe in 10, 20 years. So when it is a question of our survival, probably we will change ourselves.
Great. Well, thank you everyone again for all your questions. I know there's a comment for saving some of these questions. We will take all the questions that were posed in the chat and we'll compile them into a document, and we'll be posting them either on our website or sending a link with a follow-up with the emails from the panelists. Again, thank you again. I will pass it on to Nidhi to close it off for today.
So yes, sorry. So on behalf of the IDWG working group, I would like to thank Dr. Braitstein, Dr. Shia, Carlos, and Dr. Talukder for their time and discussion today. You have provided invaluable insight and information on planetary health, a topic that is often not very discussed about. So we also thank you to our amazing audience members for sticking with us till the very end and for your participation. There were really amazing questions that were being asked that made me think about it personally as well. We hope you continue to engage in this important topic and find ways to share the things you've learned today, whether it be on social media or with your family. Stay connected by following our social media at Infectious Info. We will have an email being sent out at the very end with our social media, as well as the emails for the panelists. So if you do have additional questions that that you were not able to ask today, feel free to connect with them via email. Thank you again to everyone for joining us today. Stay safe, stay healthy, and stay informed. And if you are a student at U of T and would like to be involved with Infectious Disease Working Group, feel free to connect with one of us, whether it be in the chat or in an email, which you can find on our websites. As for the gift cards, we have noted down the attendees for the event that stayed till the end. And we will be doing a randomized draw at the very end, and we'll connect with you via email that was entered when you registered with Eventbrite. So please make sure that your names correlate with your registrant name that you used on Eventbrite, and we will get in touch with you at the very end. But yes, that was our closing remarks. So thank you to the speakers and the audience today, and yeah, have a really great sunny, snowy weekend. Yes. Thank you, everyone.
Thanks,
Take care.
everyone.
Bye.